Hey, Dr. Mike Scheeringa here. Can really young children get PTSD? If so, what does it look like? Over the past almost 20 years, I've conducted more studies with very young children with PTSD than anyone in the world, so I know a little bit about this. In this video, I'll describe the lessons I've learned about early childhood PTSD. Stay tuned at the end, and I'll also explain how these lessons may apply to older children. First, this is a disclaimer that I'm not giving medical advice. I'm simply providing education about terms used in psychiatry and other mental health fields. First, I'll describe three major developmental capacities of children in this young age group that change the way that PTSD symptoms may be manifest compared to adults. Then I'll describe the relatively new disorder called PTSD for children 6 years and younger. Then I'll discuss older children and adolescents 7 to 18 years of age. The first major developmental difference is about memory capacities. PTSD is basically a disorder of memory. So at the most basic level, individuals need to be able to form and retain memories of their personal experiences. We call this autobiographical memory. The capacity for autobiographical memory emerges around 3 years of age for most children. If you think about your own life, you probably maintained long-term memory from something that happened around 4 to 5 years of age as your earliest possible memory. The second major developmental difference is about verbal expression skills. The normal progression of language development is that children say their first words about the age of 1 year, then they start putting phrases together around 2 years, and then typically put whole sentences together around 3 years of age. Thus, at 3 years of age, they have relatively complete capacity to communicate, which helps with two things. It helps to consolidate autobiographical memories, and it creates the main vehicle for them to express any symptoms through their thoughts and feelings to their caregivers. The third major development is the development of abstract cognitive skills to put together higher level understanding of themselves within the larger context of their world. This issue is important for children to understand that they have problematic thoughts and feelings that need to be communicated to their caregivers. For children to understand that they have a problem that is abnormal or just different than everyone else, they have to first understand what is the norm for everyone else, and then they have to grasp that the way they think or feel is different from the norm. Another way to put it is that they are developing the capacity to think about their thinking. This type of abstract thinking is emerging but still developing at 3 years of age, but won't be more fully developed until around 7 years of age, which is probably the main reason why formal schooling, called first grade in the United States, begins around 7 years of age. Recognizing these developmental differences, I started a series of studies in 1995 to document how very young children show PTSD. We were the first ones to systematically collect individual cases of very young children involved in a wide variety of traumatic events and cataloged exactly what symptoms they showed. We asked the very simple question: do very young children who have been through life-threatening trauma show the same post-traumatic symptoms as older children and adults? 20 years and 5 studies later, the answer to my question was mixed. On the one hand, young children showed basically the same types of PTSD symptoms as older children and adults. However, we needed to make several changes to the criteria to account for their developmental differences. The first change was to modify the wording of 4 symptoms to improve the face validity, which means the symptoms sound like they convey the meaning they're supposed to convey. This graphic shows those 4 symptoms that we had to modify. So for recurrent and intrusive distressing recollections, we saw empirically that children often did not express distress while they were talking about their recollections. So we said distress did not have to be required for very young children. For diminished interest in significant activities, young children don't have work or school, so it needs to be manifest in their play or social interactions or their daily routines. Feeling of detachment or estrangement is another symptom that had to be modified. Feeling detached is a pretty internalized feeling that's hard to convey with language, so we made it more behavioral and observable and just said it looks like social withdrawal as an observation. And then lastly, irritability and outbursts of anger, we changed the wording a bit to say extreme fussiness or temper tantrums, because that's how very young children manifest their anger at that age. The second big change needed for the criteria for their developmental differences was to modify the diagnostic algorithm to improve the sensitivity for diagnosing them. There was one cluster of 7 symptoms that was called cluster C in DSM-4, and those items were all what we call internalized. They were thoughts and feelings that are going on inside someone's mind and hard to convey. And you needed to have 3 of these 7 in the DSM for criteria. We modified that with the recommendations that say you only need 1 of these 7. As you can see in this graphic, I won't read them all, but you can see that they're all things that are pretty much going on inside a person's mind and are hard to know without great verbal skills from the patient who has the symptoms. I'm aware of 8 studies that have compared the old DSM-4 criteria head-to-head to this type of modified criteria for young children that we recommended. And this graphic shows the results from those 8 studies. In the far right column, you can see the percentage of children who were diagnosed with the PTSD criteria for very young children that we recommended. And then in the column next to that, to the left, is the percentage of children diagnosed with the old DSM-4 criteria for older children and adults. And you can see huge differences. For example, if you just look at that first row, 13% could be diagnosed with DSM-4 in a sample of very young children, but 69% could be diagnosed with the modified criteria, which is a huge difference in sensitivity. And you can look, quickly down all those studies, and we got the same result, and other investigators got the same result every time. We found empirically that there are other symptoms that very young children show that are not in the diagnostic criteria. We also showed empirically that they don't need to be in the diagnostic criteria. It does not help with the sensitivity to put them in, but it is worth mentioning them because you will see these commonly. Loss of acquired developmental skills, new onset of physical aggression, new separation anxiety, and new onset of fears that are not obviously related to the traumatic event. For example, a child may have had a trauma that had nothing to do with a bathroom, but now they're afraid to be in the bathroom alone. That's apparently a very scary place for very young children. I provided 5 references here if you want to dig into the literature for more detail for any reason. If you want to screenshot this or freeze the screen and look at these, they're there if you're interested. So one thing to keep in mind is that PTSD does not appear to develop in children younger than 3 years of age. So I went through those developmental capacities. They really come online around 3 years of age. There is not a single convincing case report published in the literature that I'm aware of a very young child under 3 that has full diagnostic criteria for PTSD. Many studies have been published with children under 3, but those are group studies, and they didn't provide detailed assessments to make a convincing diagnosis for an individual. Based on these developmental differences, we've also developed treatments for very young children. The book I'm showing here is a protocol I developed for cognitive behavioral type of therapy for very young children, specifically for that age group, and it was tested in a randomized clinical trial. If you're interested, this book is a step-by-step manual and also has lots of other interesting information about PTSD in this age group. After establishing that children 6 years and younger needed developmentally modified criteria, the next question was whether children 7 years and older need modified criteria. So we conducted a study. We had reliable data on PTSD symptoms from a group of 7 to 17-year-old youths from another study we were doing. We applied the regular DSM diagnostic criteria, and we also applied the modified for young children diagnostic criteria to compare the results head-to-head. This diagram shows the results from that study. On the left-hand side are the children who were 7 to 12 years of age, and on the right-hand side are the children 13 to 18 years of age. On the left-hand side, for the 7 to 12-year-old children, you see the outer light circle that's bigger represents 100% of the children who could be diagnosed. They were all diagnosable with the modified criteria for very young children. The inner dark circle represents the children who could be diagnosed with DSM-4 or DSM-5 criteria. And you can see it's only about 51%, which is very similar results that I just showed you for children 6 years and under. So this suggests that 7 to 12-year-old children probably need modified criteria also. Then on the right side is the results for the 13 to 18-year-old children. And this is a different story. The outer light circle is 100% of the children who could be diagnosed with the modified criteria for very young children, and then the inner dark circle is the DSM-4, DSM-5, and that represents 91%. So there really isn't a big difference in being able to diagnose the teenagers using the regular criteria versus the very young children criteria. So there you have it. In summary, it's not the most exciting topic. It's only important if, say, you want to accurately diagnose young children with a very treatable syndrome. I think it's kind of important. Very young children, down to at least 3 years of age, can clearly manifest post-traumatic stress disorder. Diagnostic criteria that are modified for this age group also seem to be appropriate for 7 to 12-year-old children. These modified criteria are now in the DSM-5. With the level of detail we put into examining these individual symptoms and testing the usefulness of symptoms and different algorithms, I think it's probably the most well-validated disorder in all of psychiatry, the one for very young children. There is relatively less research on older children, but it appears that, as I said, they need modified criteria too, but future studies ought to help clarify that and confirm it. Perhaps that's an issue DSM-6 will be able to take up. Comments are welcome. Let me know if there's another topic on trauma you'd like me to cover. If you found this helpful, please hit the like button and consider subscribing to my channel.